In today's world where everybody seems to be free to have sex, married and unmarried, young and old, there's an issue I want to address. And that's the sexually transmitted disease gonorrhea. I know your first reaction is it is not my portion. There it is nobody's portion. But you see, anyone that can have sex can have gonorrhea. And interestingly, 40 to 50% of persons that harbor this disease are not even aware that they are infected. That's because most times gonorrhea does not show symptoms on its carriers. And if you happen to be a pregnant woman with untreated gonorrhea, your baby could be born blind. There could also be complications at pregnancy. Have you heard of infertility in men? Infertility in women? Gonorrhea is one of the causes. Apart from HIV, gonorrhea and its sisters, syphilis and chlamydia, are other sexually transmitted diseases that are common globally and yet neglected. So in this YouTube video, I'll be talking about gonorrhea, its causes, prevention and treatment. I'm sure you would gain value. How to eat gonorrhea. What causes gonorrhea? Gonorrhea is a sexually transmitted disease, STD, that is caused by the bacterium Neisseria gonorrhea, and it can be transmitted from one person to another, mostly during sexual intercourse. This could either be vaginal, anal, or oral. So whatever the means, as far as there's a sexual intercourse, gonorrhea the disease can be established and the bacterium can be transmitted from one infected person to another. Now let's move to the symptoms. Just like I said in the introduction, most times gonorrhea does not show any symptoms on its carrier. So some persons can carry it for as long as 2 months without even knowing that they are infected, and that makes it possible for them to transmit the organism to another person unknowingly. So you see why it is important for us to regularly check our health status with the hospital. So for those that show symptoms, for females that show symptoms, there could be signs like spotting in between periods. There could be painful and frequent urination. The person could also experience pains around the anus area and blood stains while passing stool. Yes. There could also be pus-like vaginal discharge, unlike the regular vaginal discharge. For male that show symptoms, there could be painful and also frequent urination. There could also be pain around the testicles, pain and swollen testicles. The person could also experience a pus-like discharge from the tip of the penis. This is unlike the semen, so the person would know that yes, there's an issue. There will also be blood stains while passing stool, and pains. For the ladies, they would experience pain also around the abdominal and pelvic regions. These are key symptoms that, if experienced, the person should quickly rush to the health provider. Something definitely is wrong. When this bacterium finds its way to other parts of the body, such as the eyes, the throat, and the joints, it also gives key signs. In the eye, there will be unusual sensitivity to light. The person will have a pus-like discharge from the eyes and also pains in the eyes. In the throat, the person would find it difficult swallowing, and the person might also experience swollen lymph nodes around the neck region. In the joints, the bacterium could lead to pains in the joints and also difficulty in movement. So these are signs that you should watch out for, and immediately you see something like this, make a rush to the hospital. Now for complications. What are complications that could arise from gonorrhea? Number one is, in pregnant women, untreated gonorrhea could lead to blindness in their babies. It could also lead to scalp sores and infection. Untreated gonorrhea for a long period of time in male and females could lead to infertility. Yes, I know you must have heard of people having infertility issues. Their hormones are all right, they are good, but it might just be because of untreated gonorrhea that have been left for a long period of time. So infertility is one issue that could arise from untreated gonorrhea. Who are those at risk? That's a multi-million-dollar question. Who are those at risk? Everyone is at risk. As far as you can have sex, you are at risk. Everyone is at risk. But specifically, young adults within the age range of 15 to 24, men that have sex with men, and people that have multiple partners are more at risk of contracting gonorrhea. So, how can one prevent gonorrhea? Very good question. For unmarried people, one, total abstinence from sex. There's no two way about it. Total abstinence from sex. For married people, be sure of the health status of your partner. Be very sure of the health status of your partner. In cases where your partner is promiscuous, please do take cover. Please do ensure that um just do something about it. Just be sure of your own health. If you are not sure of your partner's health, do regular checkup for you to know when you've contracted this disease and for treatment to take place as soon. Also, you could make use of condom, but it is not 100% sure, because there could be situations where there are ruptures in the condom, or it is expired or not used as how it ought to. So these complications, to avoid them, just abstain and know the health status of your partner. How can gonorrhea be treated? Very simple. Visit the hospital. Don't self-medicate. I know some persons will be like, oh, the last time I had gonorrhea, I used this drug and I was okay. Please don't self-medicate. Over-the-counter drugs is a no-no. That's because resistant strains are now springing up. Resistant strains of Neisseria gonorrhea. So one might have used um medicine ABC previously to treat gonorrhea and the person was okay. Person B might use the same drug and the organism is resistant to the drug. So make sure you visit your healthcare provider. The person will run the necessary tests and know which appropriate drug to give to you as at when due. Thank you so much for watching up to this point. I'm so grateful. I hope you've gained value. Remember, I'm rooting for you. Do like, subscribe, and share. Until I come your way in the next video, stay healthy. Take care.